Did I record it? Okay.
Picture this. You have a family member who's sick in the hospital, who's in need of care, and they have a designated nurse who's caring for them. Between going to each room, going from patient to patient, touching charts, touching tools and machines, doorknobs, all sorts of things. And in between doing all of that, they are not washing their hands in between. That is pretty foul and disgusting, if you ask me. The scariest part about this is, according to the CDC, 1 in 31 patients acquire an infection in the hospital without having presented it when they first were admitted. They got it in the hospital. It's quite funny that a great portion of all this was preventable if the nurse had just taken time to wash their hands in between going from patient to patient. I would like to discuss with all of you members today in this very room why having good hand washing skills is important in healthcare specifically. First, we're going to figure out what hand washing really is and why it matters so much. Then we're going to look at how it actually works on a microscopic level to kill germs. Finally, we'll see why it's important for your patients, for nurses, and even for the hospitals themselves. What hand hygiene is and why it's important. You might be asking yourself a question right now. Let us start off with explaining what hand hygiene is to relieve the concern I know you probably are feeling. Basically, washing your hands with soap and water and washing your hands with hand sanitizer are both beneficial ways to prevent infection. Healthcare workers have been doing this for a very long time, but this goes not to say that we didn't always do these things. I'm sure you've heard of the prominent figure, Florence Nightingale. Raise your hand if you have. Wow, amazing. If you have not been introduced to my good friend Florence, let me do that now. Florence Nightingale was a prominent nurse figure during the Crimean War, and during this war, there were tons and tons of soldiers getting injured and dying. The mortality rate was very high. Florence, having a good education background, her family was very rich, and it was not normal for women to have good education, but luckily she did. She started to recognize and keep charts of the patient's outcomes when she had a clean environment and when she was washing her hands versus when she was not. Her statistics showed that nearly 60% of her patients had an increase in survival rate when there was more cleanliness and hand washing involved. The death rates dropped by 60%, and the World Health Organization to this day urges populations, according to her work, that hand washing is the easiest and most effective way to prevent illness. That's the World Health Organization. And this all matters because having good hand washing skills will prevent, nowadays, up to 40% of hospital-acquired infections. These are especially a concern for critical patients in post-operative care. That's according to the CDC. Therefore, it is safe to say that hand washing literally can save a life. How performing hand hygiene works. Let's get down to the microscopic level to try to understand how all of this comes together to prevent infections and sickness. Bacteria, viruses, fungus, all are germy little organisms, and they stick to your hands without you seeing them or feeling them. This does not go to say, however, just because we can't see them does not mean that they are not there. As soon as our germy-filled hands touch a doorknob, they are left there to multiply and spread and get it on the hands of everyone else who comes through the door that day. When we wash our hands, we stop the chain of infection and we kill nearly all the germs that were stuck to us. If this is done frequently enough, it can prevent the spread of disease to others. Now, there are two easy and effective ways to hand washing. You might have heard of them before. Number 1, hand washing with soap and water. The first option requires you to get your hands wet under the sink, get the acquired amount of soap, and rub your hands. Not just the front of your hands, no. We are going to do the tops of our hands, the palms of our hands, in the crevices, and up all the way to the wrist. The second option is hand sanitizing, which is based from alcohol, and this will kill germs by lysing their cell walls, and so they are unable to make people get infected. The trick with hand sanitizer, a lot of people actually don't know, is that you need to let it completely dry first before going to touch anything, or the germs can still be spread. Fun fact. That is also from the World Health Organization. You can think of it like this. You have really, really muddy shoes, and you walk into your house and you trace the mud everywhere around your house. That's a mess no one wants to clean up. Imagine you have guests coming into your house and they get their shoes filled with the mud that you brought in earlier. Then they go home later and their house is now filled full of mud. That's not fun either. Hand hygiene matters for everyone. Hand hygiene isn't just about germs. It impacts patients, nurses, and nurses and hospitals. Washing your hands protects your patients and keeps them out of harm's way. Not to mention, it can keep you, all of your coworkers, and give you all a better chance at lessening the chance of you contracting an illness at your specific workplace. But here's the problem. Studies show that half of doctors and half of nurses wash their hands less than half of the time that they really should. That is from the American Nurse Association. Crazy to think about. If you were having a procedure and your doctor less than half of the time was going to wash their hands in between, you would be very likely to contract an infection of some sort. This is a huge gap, and this leads to infections, especially for immunocompromised patients, which includes HIV patients, AIDS patients, people suffering, taking chemotherapy, and people with autoimmune diseases, low income, things like that. As of right now, many hospitals are working and coming together to promote hand washing and keeping the community healthy by educating all their staff members properly and having them educate everyone else, and making hand sanitizer and hand washing equipment easily accessible. And they promote these ideas with signs all around the hospital and other places in the community. That's also from the CDC. It's just that simple, folks. If everyone abided by these very simple steps, the rate of patient infection would decrease, patients would benefit greatly, and hospitals would be way safer places. Hand hygiene is simple, but powerful. It protects patients, healthcare workers, and even communities. Today, we talked about what it is, how it works, why it's so important in hospitals. Remember this for the next time you go see your family member in the hospital. Remember that hand washing saves lives.